Blood pressure.
Okay. Yes, high blood pressure is one of the things that we're quite often asked to treat as a herbalist. It's a little bit tricky, I think, high blood pressure, because mostly people feel fine. So they come in and there's nothing really for us to use as a marker other than test results of actually what happens. And if anything, sometimes you actually have to try and make them feel less fine.
Well, just a patient that recently came in actually for digestive issues, constipation, etc. Just happened to put a sphig on her. Sorry,
Sphygmomanometer.
Yeah, God, I can never say it. Anyway, stuck the sphig on her.
Sphygmomanometer. I've practiced that.
Well, the thing is, because it's most of it, more than 90% I think, is essential hypertension. Essential hypertension is just one of those really weird medical misnomers. It means we haven't got a clue. Most people have got it, but we have no idea at all what's causing it.
I mean, that's the conventional. Obviously, we've got a clue.
Yeah.
So, because you were talking about the lady that you saw last week.
Oh, yeah. Well, I've now got her on a prescription. She's got brought down nicely. She's got 120 over 80.
Okay, that's pretty good. Yeah.
Which in 4 or 5 weeks was a lot faster than I was expecting.
Yeah. I mean, the thing I find with blood pressure is that there's so many different pictures underlying it, and one of the things I started out saying there was that one of the problems is that people generally feel fine, and sometimes what we do is to make them feel less fine. I often associate high blood pressure with people who aren't all that in tune with their bodies, who don't listen to the signals that their bodies give, and who push themselves on and on through. That's one type, obviously there's a few types, but one type is people that push and push and push themselves through, and they use adrenaline to push themselves with. And that's okay until the adrenaline runs out. But one of the things there is that in order to reduce the high blood pressure, you've got to reduce the adrenaline. And the adrenaline's been making them feel great. The adrenaline's been what's been giving them the power to push on through and to ignore their body. And when you put them back in touch with their bodies again, they don't necessarily like it. So I find it quite a challenging to treat for that point of view, that people come to me to feel better and I have to say,
yeah, but that's why you put them on herbs that are relaxants, that actually scale back on the adrenaline, while then consciously being aware of what's happening. Well, that's the wrong way of putting it. Without them having to sacrifice what they think is what's keeping them going, keeping them well.
Yeah, that's true. You do normally find a way through, don't you? So there might be a little period of adjustment, but after that, they realise that they feel better without all the adrenaline.
Yeah, exactly.
You know, their anxiety levels are lower, they can sleep, they can, because often they don't realise how
they don't have that pounding in the ears anymore.
Yeah. Because they're just accepted as normal.
Yeah.
So there's those kinds of high blood pressure. Then you get types that are more about cleansing, don't you? You get people who you just feel that they're kind of, everything's got gunked up's kind of one of my technical terms. And so there you're thinking about clearing out.
Yeah, well, clearing out and vasodilation, relaxation.
Okay. What kind of herbs do you use?
Do you know the big ones for the vasodilation aspect? Yarrow, or just
course,
lime flowers. Lime
flowers is lovely.
You know.
Yeah.
Or you could, if not lime, I mean, I particularly like lime. I think it's good for it. But another one you could use just the same as valerian.
Lime flowers, by the way, is the tree, the lime tree, which is, I suppose, citrus limes do come off a tree as well, but it's not citrus limes.
Not the thing you put in your G&T, sadly. Otherwise, it'd be great if G&Ts were great.
No, and we would have much better compliance.
Yeah, absolutely.
Okay.
But you know, I think that the big thing herbally is a herb they use a lot for cancer and immune stimulation, mistletoe. You know that?
Yes. Well, that's probably professional use only.
Yeah.
I don't think it is technically, but I'm not sure I'd want to be, because it's quite it's not a difficult herb to use exactly, but it's one where you've got to know what you're doing.
Yeah, I think people are overly more cautious than they need to be.
Maybe.
Because I think you need to have reasonably high doses of this to work in blood pressure. But it does seem to act with the others to really...
Yeah.
But if you're talking about the vasodilation aspect, certainly yarrow and lime together. But as for clearing out gunk, well, that's lifestyle.
Dandelion.
Dandelion.
Yeah. Obviously lifestyle diet, yeah. But dandelion's a herb, yeah.
And do you use the root or the...
I'd use the leaf there.
Yeah. But I'm not sure about that whole diuretic thing with... do you work on actually getting rid of liquid that might be replaced, or do you work on strengthening the blood vessels and stopping the edema forming in the first place?
I think a bit of both. Because I think I have found kidney herbs useful in edema, in fluid retention.
Well, certainly it makes a big difference to the patient if you actually treat a symptom first and get a result with that.
Yeah.
You know.
Yeah. But I do think that you're right. You do need to use something that's more about strengthening blood vessels too.
Oh yeah, but
Is there anything else to say about blood pressure?
Just that it's really common, and actually not to panic too much about it. There's lots that can be done about it.
Yeah.
It's it does respond to gentle herbal treatment quite well.
Yes, it can do really well. Yes.
And because it's so common, left untreated, or as you say, a lot of people don't even know they're suffering from high blood pressure.
Yeah.
It can be a major killer. So it's one of those.
So it's really worth getting to grips with.
Yeah.
Okay.
And